there is no right time for your child to become unwell. Appendicitis is the most common reason Kiwi kids undergo emergency general surgery. In fact, 1 in 10 of us in this room will get it sometime in our life, most commonly when you're young. Appendicitis is sudden inflammation of the appendix, a worm-like structure coming off the large bowel. We know that increased duration of symptoms leads to the increased chance of this appendicitis bursting or perforating. This turns what could be a very routine surgery and recovery into a life-threatening disease. So this spreads pus and feces into the abdominal cavity. What makes it hard for parents is that it starts very mildly. Imagine you're a parent, your child wakes up with a mildly sore tummy. They turn their nose up at lunch. It's a bit unusual, but it happens. It's now night time. They're more sore, they vomit. Is this just bad tummy bug? Or is there something more? Do I need to call the doctor? What do I do? Compound that with you live out of town. You might not have enough petrol to get in. There's no one else to look after your children. As soon as you add these added barriers into a family's life, you insert inequity into our health outcomes. As a surgical doctor, I see it all the time. Overseas studies have shown that those with increased barriers to care are hit hardest by appendicitis, our indigenous, our rural, and a lower socioeconomic population. But no one's looked at it in New Zealand. So we did a 3-part study, first looking at the last 10 years of appendicitis outcomes. Every one of these 470 dots is a child in Northland who had appendicitis. They lived on average 48 k's from our hospital. That's quite a long distance. And looking at it, our rural children presented to hospital sicker, they were in hospital longer, and they had more complications. That's clear inequity, but we don't know why. So I went around to Northland communities like in Tuawai, had a cuppa, and I asked. We sat down, we made a qualitative framework. They told me what helped and hindered them getting to hospital. And putting this into one step further, we extrapolated this. We did a national study, 200 kids across the country, 14 hospitals. We took these patient-reported barriers and asked them. And then we saw the effect it had on paediatric surgical outcomes across the entire country. So putting this all together, we're able to figure out where the inequity comes from, what barriers actually affect our families, and how we can best enable our families to get to hospital and prevent the burden of appendicitis. Thank you.